Solution-focused therapy fits beautifully in medical and psychiatric settings, where time is limited, emotions run high, and people are often overwhelmed by illness, uncertainty, or stigma. In these environments, SFT doesn't ignore symptoms. It shifts the focus from what's wrong to what's possible. When a person walks into a medical or psychiatric setting, they're often used to being seen as a diagnosis. SFT invites something different, to be seen as a whole person with agency, hope, and resources. We ask questions like, what's one thing that's going okay right now? What do you hope will be different, even a little, after this visit? These open the door to optimism, even in pain. They give patients a moment of control in a world that often feels powerless. SFT is incredibly useful for providers working under pressure, nurses, doctors, psychiatrists, crisis workers, because it works in minutes. A simple scaling question can change the energy of a consultation. On a scale of 0 to 10, how much hope do you feel about your recovery? What's keeping you at a 3 and not a 1? What would a small step toward 4 look like? Even in psychiatry, where diagnosis and medication are central, SFT adds something human. What tells you you're doing even a little better than before? What would your future self thank you for doing today? We also use the miracle question, reframe for health. If you woke up tomorrow and your health challenge had eased, what's one thing you'd notice first? What would be happening around you that tells you things are changing? SFT can also improve the provider-patient relationship. Instead of saying, here's what you need to do, we ask, what's something you've done before that's helped you feel more in control? What plan would feel realistic for you right now? This creates shared decision-making, not compliance. It honors the patient's voice. SFT also supports staff. Medical professionals face burnout, emotional fatigue, and moral distress. We can ask ourselves, what got you through today? What's one moment of meaning you experienced with a patient this week? These reflective tools build resilience across the team. In settings where trauma, grief, and chronic illness show up every day, SFT provides a hopeful lens. It reminds people you are not just your condition. You have skills. You have values. You are still moving forward. And in crisis work, even a 5-minute conversation can plant the seed for healing. A compliment, a possibility-focused question, a reflection of strength. These matter. SFT in medical and psychiatric settings is about making the most of each moment, helping people see themselves as more than patients, and reminding every provider that progress can start with a single, well-timed question. Because no matter how complex the diagnosis or how brief the encounter, there's always a way to connect, empower, and build towards something better.